We know that people who have gallbladder problems end up with severe headaches and often migraines on one side of their head or the other. We know that people who are chronically constipated have gallbladders that don't work the way they're supposed to. They're not dumping their contents. And that's what stimulates what we call peristalsis. That's the movement of the intestinal tract, so you get rid of the stuff that shouldn't be in there. But unfortunately, because of sugars and sodas and coffee and black teas and fast foods and fried foods and alcohol and glutens and lack of water, lack of water. Most of you don't like water. You think that's something that you wash in and not supposed to drink. Sugars, gluten, the amount of fats that we get in our foods, the saturated fats, the trans fats, all of those things can cause the gallbladder problem. Black pepper. Too many of you put black pepper on everything that you eat. You have some poached eggs and it looks black. It looks like you put shingles on top of it. Well, there's a problem there because it's one of the most inflammatory things that you can do to irritate your gallbladder. So how do we know and how do we identify it? Well, there's a lot of ways of knowing, but you have to identify the problem. In applied kinesiology, which is the specialty that we do in our practice, we have a very straight-up way of identifying functional relationships in the body. My leg hurts. My knee hurts. There are muscles that relate to every organ system. The gallbladder is no different than that. There's a muscle behind your knee called the popliteus muscle. It's a trapezoid-shaped muscle. It's responsible for the last 5% of extension of your leg when you straighten your leg out. And that muscle relates to gallbladder function. And sometimes I see patients who have swollen knees, and there's nothing wrong with the knee initially. It just comes on kind of spontaneously, and as a result of the gallbladder not working and its effect on this muscle. So the muscle doesn't work because the gallbladder is not working. The acupuncture system travels through the knee. That has to do with the gallbladder. So does the liver acupuncture channel. And now we have a knee problem. So if we don't treat the gallbladder, if we don't treat the energetics, the knee problem never goes away, and then ultimately over a period of time it begins to break down, and then we get degeneration and we get joint destruction and we get bone on bone over a period of time. That could be months, it could be years, it could be whatever. Now, symptomatically, the gallbladder begins to show itself after a long period of time. It's not something that comes on necessarily right away, or we at least don't recognize the symptoms. They begin to be subtle. We just kind of don't feel really good, sluggish, a little bit of a dull headache. Our bowels aren't moving the way they're supposed to. We get a little bit of bloated, and then we get this pain. Again, it cascades quickly. And once it hits that place, pretty soon it's not only sluggish, meaning it's kind of sand-like and gravelly, but now we begin to develop the stones in there. And we see these cholesterol stones, and then the cholesterol stones ultimately become calcified, and then they begin to irritate even further, and begin the process of infection, and the infection can spread and can get worse and worse and worse. We can stop that process if you're willing to do something differently than what you're doing now. Remember, where you are right now is because of all those things that you've ignored, the decisions that you've made up until this moment in time. The good news is, as long as you're breathing, as I said 1,000 times, is that you can reverse anything. Welcome back. This is Dr. Tom Roselle. I'm going to educate you about things that can help you ongoingly, things that can make your life a whole lot different than it's been. We're talking about some very interesting concepts and putting together the triad of health and the 5 factors, meaning the 5 systems of the body: the nervous system, the blood supply, the removal of waste through the lymph system, the movement of spinal fluid, and the acupuncture system. Remember that there's only 3 things that can cause anything: either injury to the body in some way, whether it's significant or something mild that has accumulated over a period of time, even bad dentistry. It can be dietary patterns, indiscretions on your part, anything that comes into your body from the outside. You live and work in an environment that is not quite as supportive. And the third is emotional stress. Your body doesn't know the difference between something that you think about and something that actually happens to you. Functionally, it is the same. By the way, I wanted to remind you, inflammation triggers a thought process and a diagnostic tool that we use in our office. Thermography Centers of Fairfax is an ongoing sponsor of Dr. Tom Roselle Live. We use thermographic imaging to diagnose areas of inflammation that sometimes are hard to find in any other way, because inflammation can be localized. So in the case of a gallbladder, when the gallbladder becomes inflamed and we have other diagnostics that aren't indicating that this is the condition, thermographic imaging will show that. It'll show the gallbladder hot, it'll show it inflamed, it'll show the allergic response, the inflammatory reaction that goes along with it, as well as obviously showing up the predispositions in many cases of breast cancers and other types of problems throughout the body and the intestinal tract and so forth. Thermographic imaging is something that all of us should have as part of our ongoing annual diagnostics. It is a tool that is invaluable, relatively inexpensive. As a matter of fact, this month, Thermography Centers of Fairfax is offering to do a full-body thermographic examination, normally $475 for $400. $475 procedure for $400. It's called Dareth Painter at 703-943-7248. That's 703-943-7248, and ask her about thermographic imaging and Thermography Centers at Fairfax special for January. We use it. If you have a gallbladder problem, it's something that is invaluable. So how do we handle this gallbladder? Remember, this is just a few of the procedures that we utilize, and there are other pieces to the puzzle. You have to check the body neurologically. There are nerves from the middle of your back, in between your shoulder blades, that go directly to the gallbladder. If those nerves are irritated in any way, guess what happens? It's like turning the system off. So we have to check out the nervous system. If the acupuncture system has been injured, or if there's a backup from the liver causing the gallbladder not to work the way it's supposed to, we've got a problem. So we have to check those areas. There are blood tests that will show, but those blood tests don't show until you get a place where pathologically things are starting to develop. Remember, normal blood work shows a state of condition now. It doesn't show the functional state as beginning to develop. When you're beginning to have symptoms, that's the time to do something about it. Symptoms are the time that your body's telling you something's wrong, do something about it. If you wait to the place where the symptoms are irrevocable, or the symptoms are a place where you can't tolerate them anymore, generally you've gone way too long, and you could have done something so much earlier on to stop it. So what we're going to do about this? First, if you're eating things that you know you shouldn't be eating, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, junk, right? And you're not getting enough water in your diet. What do I mean by that? I mean 1 ounce of water for every 2 pounds of your body weight. And you're not flushing your system out, and if you're drinking things that, have a lot of junk in them, a lot of sugars and caffeinated products and so forth, you're going to have more of a problem. If you're eating foods that are highly fatty, trans fats, particularly in saturated fats, you have issues. So you've got to start by eliminating things. You've got to get rid of the black pepper. You have to get rid of things that are fatty and greasy and rich, and some of the beans and shellfish, and if you're eating a lot of red meat, you got to start backing that off. If you don't do that, if you're not willing to make a change, then you're destined to the knife. Ultimately, some surgeon needs to make a carb payment. Excuse me, I didn't say that. And they're going to say you have to have a gallbladder removal. And at that point, you're probably stuck. You're in trouble. By the way, black cherry juice is great for gout, but it's also good for the gallbladder. You have to also make sure that there's enough acidity in your stomach. If your stomach isn't producing enough acid, it cannot trigger the gallbladder and the pancreas to do its job. Many of you are on acid blockers to stop acid production in your stomach. Guess what one of the end products of that is? Gallbladder dysfunction and many other things. Besides, you're not going to absorb calcium, you're not going to absorb protein, you're not going to absorb B12, but nevertheless, you're going to have an issue with gallbladder function. If you have high levels of bad bacteria, there's several of them that will cause a problem with gallbladder function as well as other organ systems as well. So the integrity in the intestinal tract has to be looked at. The most common offending foods are going to be things like eggs, believe it or not, pork, onions, different types of chicken for some people, dairy products, oranges. Even though there's a lot of advertising out there that says coffee is great for you, sometimes coffee can cause a problem. Many of you are allergic to coffee. Many of you drink a cup of coffee because you think it's going to keep you awake, and you got to have that cup of coffee, but meanwhile it's causing an inflammatory response in the body. People say, well, I have to have my coffee. Well, listen, if you got to have a cup of coffee and there's no way that I can get you to stop, then go get 100% organic Kona coffee. You got to go online to get it. I'm not selling it to you. That's where you get it. And then that, by the way, will help dump your gallbladder and do some other things. But many of you are allergic to it, and subsequently you're going to have a problem. Consumption of decaffeinated coffee didn't do anything for gallbladder, so it's in a catch-22. Some of you can't have it, and you're going to go out and say, well, it's good for my gallbladder, and it makes me go to the bathroom. The reason that it does that is because it does have a double-edged sword. So, the jury's out as far as I'm concerned, and you've got to understand the study. So I'm not telling you that coffee's good for you. Please don't take that from what I just said. Refined sugars, low residue foods, all of those things can cause you a problem. Vegetarian dietary patterns seem to be more supportive if they're real vegetarian diets, meaning a lot of vegetables, a lot of fruits, dramatically decreases the incidence of gallbladder problems and gallstones. Many of you can change a whole lot of things if you did nothing more than add that to your diet. Go out and get fresh vegetables, cook them, stir-fry them, pressure cook them, steam them. It's quick. Get a big bowl and pre-cut your salad and put it in there. You need to have at least a half a cup of vegetables 7 times a day. That's not a lot. You can eat a bowl of salad and you've already got 2 cups, and that's 4 servings. And I'm talking about a big bowl. As a matter of fact, if you came to my house and you watched me eat at nighttime, most of you say, oh my God, what does the guy put in his body on a regular basis? I eat more vegetables at one meal than most of you eat in a day. Most of you eat in a week. It's because it makes my body work. It makes my body feel good. It gives me energy. Many of you are sluggish and can turn it around 2 things. Drink a lot of water and eat a lot of vegetables during the day, and then get rid of the sugar, sodas, coffee, teas, fast food, fried foods, and junk. You know what? If you did nothing more than that, I promise you that the majority of your problems would go away. If you did nothing more than that and then added walking 2 miles every day, just 2 miles, you would be surprised the quality of health and life that you would begin to own. It's that simple. This Wednesday night, I'm going to take you through step by step, and I'm going to show you how to increase your health. And I'm going to show you how easy it is to change things if you want to change them. Many say, I don't have the time, I don't have this, I don't have that. Well, it's a decision. It's a choice. Health is a do-it-yourself program, and it starts with a decision process. Are you willing to do that? Are you willing to make a difference? I will give you the motivation, but you have to be the carry-through. You're the one that has to decide that it's important to you, that you can change what you need to change. Can you get rid of stones? Absolutely. With somebody who knows what they're doing, you can follow through, you can do a gallbladder flush, but you have to step into it slowly. If you have a hot, inflamed gallbladder, please don't try a gallbladder flush by yourself. It will cause some problems. Generally, you're going to do this flush over a period of a week. It's something that's been used by natural health practitioners for a long time. You go to a book by the name of Back to Eden. Jethro Kloss was the author. It's a standard in naturopathic medicine. And every other good nutritional practitioner since then has been using a gallbladder flush in one form or the other. There are several different methods that are used, but the ones that we can support, basically what you do is you drink a lot of apple juice for an entire week. You cut your diet back so it's very supportive, very alkaline for the week. Some of you have to do other things to soften some stones that you may have for a week or 2 prior to this. And then the night that you're going to do this flush, you're going to eat an acidic meal, meaning nothing other than things that are naturally acidic, meaning fruits, tomatoes, lemon juices, and so forth. And then you're going to drink olive oil, and you're going to have something called disodium phosphate, and then you're going to bed, and you're going to lay on your side. And the next morning, you're going to probably have some diarrhea. Sometimes you have to use an enema to help break some things up because many of you have been constipated for a long period of time. You know, when a patient comes in to tell me that they haven't had a bowel movement in sometimes a week, sometimes 10 days, I'm not making this up. It's amazing to me that people can go around like that, and I wonder where they put it, because they've got to eat every day. They've got to put water in their system or something in their body every day, but the colon will expand, and it becomes very, very unwilling to expel its contents, and pretty soon it gets like cement. The nervous system isn't working. The acupuncture system is beginning to shut down. But when you do this flush, things begin to move, and sometimes you'll pass things that look like contact lenses. You'll look at the contents, and you'll see green or brown spheroids that sometimes are presumed to be gallbladder stones. And anytime you see this stuff, you know that gallbladder has been impacted negatively. But you're finally doing something that is very positive, it's very powerful. You may have to do it again until you get clear flushing, until the gallbladder begins to work. And then after that, you may do something called a vitamin C flush. So you can get rid of it. You can make a difference. So in dealing with the gallbladder, if you've done the flush, there's things that you need to do afterwards. We talked about maintaining high levels of vitamin C, called a vitamin C flush. But start out with simply 500 milligrams and every day double it until you get to 2,000.